Welcome back to Healthy Living, brought to you by St. Tammany Health System. We're talking today about men's health, prostate cancer diagnosis and treatment, and new technology at St. Tammany Health System called UroNav. We spoke first with Dr. Joshua Sleeper, a local urologist, about the overall idea of men's health and how prostate cancer is a driving factor. Then we spoke with Dr. Joshua Yellen about the perspective of the radiologist in the new technology UroNav. Last, we'll be talking with Kim Belsom, an ultrasonographer with St. Tammany Health System. Good morning, Kim. Thanks for coming.
Thank you for having me.
Really excited to have you here.
I'm excited to be here.
So we've been talking from the medical perspective, what the doctors diagnose, what they see, how they're using this technology. Can you talk a little bit from St. Tammany Health System's perspective, your ultrasound team, and what your background is?
Sure. So we are general and vascular sonographers, and basically what that means is we do everything except for heart ultrasounds, echocardiograms. We'll do, abdomens, thyroids, DVT studies to make sure you don't have a blood clot, babies, of course, baby heads, baby spines. There's just a various amount of ultrasounds that we do at St. Tammany. We also, what I don't think other people realize that we do is we do a lot of procedures and a lot of biopsies with our radiologists. We do paracentesis and thoracentesis, which are draining fluid from the abdomen and the chest cavity. We also do liver biopsies and lymph node biopsies. So we do a lot of procedures also. It's not just scanning, normal ultrasounds. And then, so one of those procedures that we do is the prostate biopsies with the urologist. So our team at St. Tammany, the sonographers, we have some people that are still with us that were students from, we train them and they're still with us. We have some techs that have been there up to 17 years. So there's a lot of level of experience in that department. And we currently, there's 2 of us that have just recently trained in the UroNav. But we do want to train everybody because we feel like everybody needs to know how to do everything at St. Tammany to be able to do all procedures and all exams.
Fantastic. So, we'll talk a little bit about what your training was before UroNav, and then let's talk a little bit about what you did to train for UroNav.
So before UroNav, honestly, the urologist really just needed the ultrasound machine. We were up there to assist them if they needed any sort of adjustments to the machines, to the settings, to get a better quality image. Also just to be there if they had any ultrasound related questions in general. But they're the ones that scan, they're the ones that do all the biopsy part.
So you're the support, but then next.
Right. So now we actually are running the UroNav machine, the computer that does all the, takes the MRI and fuses the ultrasound image. So we'll have the UroNav machine and then we'll have the ultrasound machine right next to it. And so those communicate together. So as the urologist is scanning and looking through the ultrasound machine, we can also see it on the UroNav. So they'll do a sweep of the prostate and it creates a 3D image. And so we take that image on the UroNav that's fused with the ultrasound and the MRI, and we'll make little parameters and kind of line it up with the MRI. So that way when they're scanning and they'll see like the target and the lesion and they can go exactly for that lesion. And so there's this little, it's electromagnetic field generator box. It sits above the patient kind of on a pole. The ultrasound probe has a clip that has a tracking device, and then it has a biopsy needle on the other side of it. So there's a lot going on in the probe, but it's also connected to both the ultrasound machine and the UroNav machine.
Great.
So we do a lot more now than we were before.
That's what I was thinking, that you have the urologist, the radiologist, and the ultrasonographer all have a role to play here. And there's equipment that has been a part of the practice for a very long time, and then this is a new layer of technology.
Yes, ma'am, it is.
Okay. Well, talk a little bit then about the, you were mentioning the 3D modeling. So you have what the ultrasound shows, and then you have what the UroNav is sort of creating from that.
Mm-hmm. So after they have the MRI prostate and Dr. Yellen does his adjustments and does the parameters and outlines where the lesions are, when we go into the operating room, we have to download those images onto the UroNav. And so when we connect the ultrasound machine to the UroNav, we, as the urologist is scanning, we're able to create that 3D image and the biopsies.
And I'm trying to understand what happens once you have that 3D image going, that is in the UroNav, and what is the urologist benefiting from there?
They're able to see the entire prostate from different angles, not just one 2D image like you can in an ultrasound machine. Okay. So basically when they do, the difference from when we used to, the regular way of doing prostates and now, is that when they do take those biopsies with a needle, we can see the needle go into the lesions, and we can document exactly where every needle goes through. So at the very end, we get another 3D image that has the prostate, the lesions, and then the needles from every single angle. So we look at that at the very end to make sure that we have, that we've gone through the lesions and have a good, accurate biopsy. So
outstanding. So really, your history of the work that you did before UroNav kind of got you ready to be able to see this in a whole different way, and it enables you and the physicians to come away with far more certainty.
Yes.
And data that really suggests that you've found those lesions, you know what you're dealing with, and that is a tool that the physicians then can use for diagnosis and treatment of prostate cancer.
Yes, before with the ultrasound image, sometimes you just don't get a quality image of the prostate. And so before it wasn't really, sometimes you could completely miss the tumor, whereas now when you're looking through the UroNav and it has that target and you're lining up the biopsy needle guide with the target, and that's when they're taking the biopsies, you know that you're getting a good quality specimen because you can see it going through the target that's outlined by Dr. Yellen already on the MRI. And so, it just kind of helps with a more accurate diagnosis and an earlier diagnosis for patients as well.
Fantastic. And obviously early diagnosis is really valuable because the sooner we find it, the easier it is to treat and the more likely it is for full recovery.
Exactly. Right after we first started doing the UroNav, one of the urologists came into the operating room and said that one of his patients, he really didn't think it was going to be as aggressive as the diagnosis came back, and so that completely changed his course of treatment for that patient, which is huge because it really is truly saving lives by getting the diagnosis earlier. So
that's fantastic. I love that story. That obviously the health system has to make decisions about what technology it will and won't buy, and investment in something like UroNav is a big decision. And then to have a physician able to definitively say, look, this made a difference for this patient because we thought we had something this big, and it turned out that it was, this big.
Right, and it also makes me feel very excited and proud to be a part of it, because before when we would do prostate biopsies, they really didn't need us. They were just using an ultrasound machine. As sonographers, we don't always get the results because we're just there to assist, so we don't get to see the end of what the results are in the course of treatment and to follow up with those patients. So to hear him say that, it was like, okay, what I did on the UroNav helped him to do his part, which helped to get a good diagnosis and a more accurate and diagnosis for the patient. So.
Well, and that's a wonderful way to show how technology is helping us keep the patient at the center of care and to save and change lives.
Exactly.
Well, Kim, thank you so much for coming in today.
Thank you so much for having me.
This is Melissa Hodgson. You've been watching Healthy Living, brought to you by St. Tammany Health System. We talked today about UroNav, men's health, and prostate cancer. Join us next month for another show on Healthy Living.